Back again for the third movie. Just to give you another clue about what topics, orientations, and foci, I suppose the plural is. A focus is. I'm also going to get you through the first couple of sentences of a second text. Now, I provided this text clean to you as well, so please try to analyze it yourself before you follow me in this particular movie. Anyway, here we go. Assuming that you have tried to mark it yourself, you've got your highlighters diligently lying there on your desk to go through this text. And after you did that, you open this movie and you see me say that this is, of course, a topic. Now, this is one of those generic topics again there, because at the beginning of a text, you need to know where the topic comes from. You need to understand why that is what we are talking about. And since it's the beginning of a text, you don't know yet. So you ease the reader into there with some sort of generic type of topic. So there is growing interest in electronic access to health information and the use of digital data for both disease and health tracking. There. That's your first focus. Widespread use of health information technology, there, that's your first topic, could potentially increase patients' access to their health information and facilitate future goals of advancing patient-centered care. There. This is, by the way, I forgot to tell you that, a text about a research on how patient portals and health apps actually may or may not contribute to people feeling more empowered and being more engaged and being more compliant with therapy. Okay, third sentence. For example, is the orientation. Health IT is in this case the topic. Can be used to facilitate information exchange with clinicians and instruct patients when to act upon clinical issues, such as out-of-range physiologic parameters, follow-up test results, and complications of medical use. Here you can see a small problem already, because when you end a sentence with so many examples, then that's what's going to stick into the reader's head. This would have been better if you had said, for example, health IT can be used to facilitate information exchange with clinicians and instruct patients when to act upon clinical issues. Examples of those issues could be out-of-range physiologic parameters, follow-up of test results, and complication of medication use. Then it's already easier to read and easier to process. Okay, well, setting that aside because this is still an okay sentence, let's move on to the next sentence. Tools such as personal health records, patient portals, and various mobile health application apps. There, that's a very long topic, have been developed to help patients engage. Now, here the writers were, to help patients engage in their own care. That's all still part of the focus. Here, the writers have saved themselves by saying to help patients engage in their own care, because that's what they actually want to say. What Dutch people do a lot, and please be vigilant to that in your own texts, is write sentences like this. Tools such as personal health records, patient portals, and various mobile health applications have been developed. Have been developed is then your focus. And that doesn't mean a lot, it just means that they are there. But it's not really the focus of what you want to say. So you always need to make sure that you have a meaningful focus in the second half of your sentence, in the focus part of your sentence. Here the meaningful part is to help patients engage in their own care. Apparently that is what this article is about, or at least what the writers, he or she, or them, are leading us to. Now, next sentence. Orientation, a significant number of patients here use health IT there. Therefore, I consider the semicolon the end of a sentence, so I'm starting with an orientation again. Well, this is a little bit harder to analyze. According to the rules I taught you, it would be it. However, if you really look at it closely, you would say it is essential that. But let's not do that. Let's for now say it is essential that patient-facing health IT be tailored to their needs. So the point that he's trying to make, the focus, the thing that he wants to talk about is that patient-facing health IT should be tailored to those specific patients. And then he moves on to the next topic or to the next phase. He says, in this paper, so we have another orientation. Now the reader knows, okay, whatever the next sentence is going to be about, it's going to tell me why I read those sentences before about health technology and what their specific angle is going to be. That makes sense because you just talked about in this paper, so now we is apparently the authors. They have basically been kind of introduced by in this paper. We discussed two forms of patient-facing health IT tools, patient portals and apps, to highlight how, despite several limitations of each, combining high-yield features of mobile health apps with portals could increase patient engagement and self-management and be more effective than either of them alone. Are you still there or did you lose me? Because this is an impossibly long focus. Nobody wants to read a focus that goes on for 1, 2, 3, 4, a little bit over 4 lines. You lose focus if you have a too long focus. I mean, literally, you lose your focus. This sentence would have been increased, this part of the article would have been improved so much already if they had written something like, in this paper, we discussed two forms of patient-facing health IT tools. On the one hand, there are patient portals, and on the other hand, there are apps. In our discussion, we will highlight how, despite several limitations of both tools, or both type of tools, the combination of high-yield features could increase patient engagement and self-management, and therefore be more effective than either of them alone. Suddenly, you have 3 or 4 small sentences, and in those 3 or 4 small sentences, you help the reader jump from focus to focus to focus. And the point that you're trying to make, the combination of the two of them is effective, is still there. It's more powerful now than in this impossibly long focus that we have here. Now, mind you guys, this is a professional text. Somebody has approved of this text, it was published. So sometimes you can apparently write a crappy sentence and still get published. However, not often. Now, join me in the next movie where I will explain some more about good patterns and bad patterns.